Good morning. Today's my lecture topic name is Instrumental Examination Methods of Esophagus. Plan of the lecture. The first, we will discuss about X-ray examination, endoscopy of esophagus, computer tomography, endoscopic ultrasound, esophageal manometry, esophageal impedance, esophageal pH monitoring, radionuclide scintigraphy, and acid perfusion test. The first, X-ray examination of the esophagus is currently one of the main methods for diagnosing its diseases. We use barium sulfate lime for examination. Barium sulfate lime is a thick viscous substance. When the patient takes it, it covers the mucous membrane of the esophagus and stomach, and the doctor sees the relief of the walls of both organs. During rentgenoscopy, it is possible to observe the passage of the part of the contrast material and to study the functional disorder of the esophagus. By X-ray examination, we may identify the condition of the esophagus, form, size, contours, relief of the mucous layer, and various motor disorders. In practice, the following methods of X-ray examination are used: rentgenography and rentgenoscopy with barium sulfate lime, secondary contrast method, X-ray cinematography and X-ray television, pneumomediastinography, computer tomography, and nuclear magnetic resonance. During rentgenoscopy, it is possible to detect functional disorders of the esophagus by monitoring the passage of a portion of contrast material. The following changes can be identified by X-ray: esophageal tumor, foreign body, hernia, achalasia, strictures, annular constructions, diverticle, varicose vein, mucosal wound defects. It is a picture of esophagus. It is a diverticle of esophagus. In the next slide, we can see structure of the esophagus. Next slide is about esophageal cancer. In this slide, we can see achalasia. It is also a picture of achalasia. Next examination method is endoscopy. Examination of the esophagus with the help of endoscopy is carried out in a fibroscope with the optical device on the side. We can identify inflammation, mechanical and chemical damage, wounds, erosions, fistulas, level of changes in areas with the epithelial metaplasm, tumors, coloring areas with metaplasia, take a biopsy, and hernia. It is a picture of esophagus by endoscope. We can see normal esophagus, stricture, polyp, and varices. In this slide, we can see erosions of esophagus and polyp of esophagus. It is about granular cell tumor of esophagus. In this slide, we can see squamous cells carcinoma of the esophagus. It is esophageal varices. It is esophageal bleeding. And also, we can identify esophageal ulcer. Then we can identify foreign body of esophagus. Not only identify, but also we can check this foreign body of esophagus by fibroendoscope. Next examination method is computer tomography of esophagus. We can identify depth of damage, degree of spread of tumors, distant metastasis, stage of development of malignant tumors, normal esophagus. Endoscopic ultrasound. Endoscopic ultrasound is a procedure that combines endoscopy and ultrasound to create images of the digestive tract and nerve organs and tissues. It is also called endoscopic ultrasound. During endoscopic ultrasound, a thin, flexible tube called an endoscope is placed in the digestive tract. An ultrasound device on the tip of the tube uses high-frequency sound waves to create detailed images of the digestive tract and other organs and tissues. Endoscopic ultrasound helps diagnose conditions that affect the digestive tract and nerve organs and tissues. And endoscopic ultrasound tube placed down the throat capture images of the esophagus, stomach, and parts of the small intestine. Esophageal tumors can be detected early with the help of endoscopic ultrasound. However, the disadvantages of endoscopic ultrasound is that the device cannot move from the damaged area to the proximal part in obvious stenosis of the esophagus, and it gives little information in assessing the safe or dangerous nature of the enlarged lymph nodes. Next examination method is esophageal manometry. Esophageal manometry is a test that shows how well the esophagus is working. It measures muscle contractions of esophagus as the water moves through to the stomach. This test can be helpful in diagnosing esophageal condition, especially if you have trouble swallowing. This method is effective in diagnosing of the achalasia, diaphospasm, and scleroderma. And in achalasia, in this condition, the lower esophageal sphincter muscle doesn't relax enough to let food enter the stomach. Symptoms include trouble swallowing and food coming back up the throat. Next, diffuse esophageal spasm. This happens when contractions of esophageal muscle are frequent, forceful, and out of sync. This can result in trouble swallowing or chest pain. Next syndrome is sclerodermia. In sclerodermia, muscles in the lower esophagus stop moving, causing severe gastroesophageal reflux. Sclerodermia is a progressive condition. Next examination methods is esophageal impedance. What is esophageal impedance? Esophageal impedance is a diagnostic test that measures the amount and type of gastroesophageal reflux in the esophagus, the tube through which food travels from the throat to the stomach. Doctor uses this test to determine if a patient's symptoms are correlated with a reflux. Even to diagnose gastroesophageal reflux disease, a chronic disorder that happens when acid, food, or fluid flows backward from the stomach into the esophagus, causing symptoms. In this test, a thin, flexible tube is passed through the patient's nose, down the back of the throat, and into the esophagus. The end of the tube is attached to a computer that remains at the patient's bedside throughout the study. An impedance study typically takes 20 or 24 hours. The tube is left in place during this time. The patient can stay in the hospital or go home with the tube in place, depending on their other diagnosis. It is esophageal pH monitoring tube inserted through the nose or mouth to the esophagus. And esophageal pH monitoring is a test that measures how often stomach acid enters from the mouth to the stomach. The test also measures how long the acid stays there. How the test is performed. A thin tube is passed through your nose or mouth to your stomach. The tube is then pulled back into your esophagus. A monitor attached to the tube measures the acid level in your esophagus. You will wear the monitor on a strap and record your symptoms and activities over the next 24 hours in a diary. You will return to the hospital the next day and the tube will be removed. The information from the monitor will be compared with your diary notes. Infants and children may need to stay in the hospital for the esophageal pH monitoring test. A newer method of monitoring esophageal acid is by use of wireless pH probe. This is called by Bravo pH monitoring system. This capsule-like device is attached to the lining of the esophagus with an endoscope. It remains in the esophagus where it measures acidity and transmits pH levels to recording device worn on the wrist. The capsule falls off after 4 to 10 days and moves down through gastrointestinal tract. It is then expelled with the bowel movements and flushed down the toilet. How to prepare for the test? Your healthcare provider will ask you not to eat drink after midnight before the test. You should also avoid smoking. Some medicines may change the test results. Your provider may ask you to not take this for between 24 hours and 2 weeks before the test. You also may be told to avoid alcohol. Medicines that you may need to stop includes adrenergic blockers, antacids, anticholinergics, cholinergics, corticosteroids, H2 blockers, non-steroid, anti-inflammatory drugs, proton pump inhibitors. What abnormal results mean? Increased acid in the esophagus may be related to Barrett esophagus, difficulty swallowing, esophageal scarring, gastroesophageal diseases, heartburn, and reflux esophagitis. Next examination method, radionuclide scintigraphy. Radionuclide scintigraphy is an important and non-invasive method to determine the motor function of the esophagus and its transport capacity. Techniques dilated in what is given to the examine. A series of scintigrams of a series of stomach and esophageal segments are obtained using a gamma camera connected to a computer. This test can be used to quantify gastroesophageal reflux and the rate of esophageal relaxation. Next test is the acid perfusion test, helps to determine the specific symptoms and causes of esophagitis and to make a comparative diagnosis of the pain syndrome related to the heart or esophagus. 0.9% sodium chloride solution is injected into the examiner's esophagus at a rate of 6 and 7.5 ml per minute. It is injected for 15 and 30 minutes. Then the solution is changed to 0.1 and hydrochloric acid. If pain, burning sensation, and CNR of esophagitis observed when 0.1 sodium hydrochloric acid is injected, the test is considered positive. 0.9% sodium is a complaint disappear when the chloride is reintroduced. Thank you for attention. See you next my lecture.